So our first speaker is Laura Beach. So Laura is a PhD candidate in the Department of Anthropology at the University of Toronto. They are broadly trained scholar with expertise in the areas of criminalization, incarceration, and mental health, mental illness. Laura's doctoral research focuses on experiences of care and caring relations with prisons in Saskatchewan, where they have conducted interviews with people who have been incarcerated and also with correctional staff. Laura has been researching incarceration for 6 years and also volunteering in federal and provincial prisons for over 5 years. And Laura grew up in Kemptville. So please unmute yourself, Laura, and over to you.
Thank you, Victor. So as Victor noted, I am a Kemptvillian in that I was born in the Kemptville Hospital, one of the last babies born at the Kemptville Hospital, in fact, and I grew up in Kemptville. I went to elementary school and spent some of my high school years in Kemptville as well. I also have roots in Kemptville through my family. My grandfather taught at the Kemptville Agricultural College, where my father later worked in a position with the University of Guelph. And my mother also worked on the same campus, but with adult education, continuing education. So I do have a connection to Kemptville, although I left and haven't lived there permanently since high school. I've also continued to return to Kemptville as a performing musician, playing a number of shows at the Branch, as well as at the Dandelion Festival and the Kemptville Live Music Festival. So I have maintained some ties to Kemptville, despite having moved elsewhere. So as Victor noted, my own PhD research focuses on experiences of incarceration, particularly with regards to care. And this includes physical and mental health care, the official provision of care within corrections, and also informal moments and relations of care between and among prisoners and staff. I have to say right off the bat, I was disappointed to hear that a prison was being planned to be built or was proposed to be built on the acreage near the campus. I have a number of issues with the plan to build yet another correctional facility, not only in Ontario, but in Canada more broadly. So through my research, through interviewing folks who have come into conflict with the criminal justice system, as well as folks who work within prisons, and this includes correctional officers, nursing staff, and psychomedical staff, I have learned a lot about what Edward Sykes called the pains of imprisonment. So prisons are spaces where increasingly prisoners are isolated from the community. And this has actually increased over recent decades. And particularly within the COVID era, prisoners are incredibly isolated from their community. So there is an intense separation from family and community support, which is extremely harmful and also hinders rehabilitation and meaningful reintegration. Lack of public transportation within the specific context of Kemptville would further hinder this, as previously noted by CAPP presenters in the previous forum. Point blank, video calls, video visits are not the same, as many of us have learned over the pandemic. It's not the same as a face-to-face visit, and this is particularly true for the children of folks who are incarcerated. Something else that I have found through my research is the prevalence of medical neglect within prison spaces. Prisoners going for long periods of time with medical issues that become increasingly more complicated because they are neglected. I've spoken with prisoners who have been denied HIV medication, prisoners who had abscesses, issues with their teeth, any number of issues going on, and who have struggled to meet with medical professionals. And this is often because you have, for example, in the case of the Regina Correctional Center, 2 nurses on staff to meet the needs of 400 prisoners. So medical neglect is a serious issue within prisons. The continued use of solitary confinement within prisons is something that contributes to psychological deterioration as well as physical deterioration, and solitary confinement continues to be used. It is a commonplace practice, both within provincial and federal prisons, despite international human rights legislation and despite Prime Minister Trudeau promising to cease the use of the practice within federal prisons. So prisons are spaces where mental health issues are exacerbated, and they are also spaces where addictions issues are exacerbated. So this is particularly troubling given the correlation between criminalization and mental health and substance use. So you have folks who are incarcerated in a space where there is inadequate support for mental health. I've spoken with prisoners who waited for over 3 months to access a psychiatrist, even though they had previous diagnoses of anxiety and post-traumatic stress disorder. You also have what I call the myth of sobriety within prisons, where not only are drugs easily accessible, some folks have told me more easily accessible in prison than they are on the street, you also have the overuse of antipsychotic prescription medication. Notably Seroquel, which is a medication designed for use for folks with schizophrenia or major depressive disorder, but it is commonly used within the prison context as a sleep aid. So I've spoken with a number of prisoners who have spent the majority of their time in prisons on a prescribed medication, one that was not prescribed by a psychiatrist, but by a general practitioner, in a state of essentially being a spaced out zombie. So it's important to ask ourselves within this context, how are prisoners meant to be meaningfully rehabilitated? How are we meant to be meaningfully engaging individuals toward their reintegration into society? Because after all, that is the end goal, the stated end goal of incarceration. And the simple conclusion is that we're not. Prisons are not doing what they have set out to do. And there is this notion with the new prison, we hear this, we've heard this before, this time it's going to be different. This prison is going to be different. And quite frankly, this is not true. What we have seen, if we look back at the Task Force for Federally Sentenced Women in the 1980s, there was a lot of hope around the new federal regional prisons for women that were established across Canada. These were cottage-style living units. They were inspired by the Scandinavian approach to corrections. And yet, before these facilities were even open, programming was cut, program space was cut, and a bigger budget was allocated to security. And now we have women who are incarcerated at these institutions being frisked every time they move between buildings on the site. So what we have ended up with is actually increased security, which manifests in lived experiences of humiliation and dehumanization on a daily basis. And this takes a massive toll on prisoners' mental health and well-being. So the bottom line is that prisons are prisons. And as much as we'd like them to be about rehabilitation, we have been saying this since the 1940s. And I've got documented quotes if anybody needs them. But correctional experts, correctional administration, public officials have been saying, almost literally word for word, prisons should be about rehabilitation, not punishment, since the 1940s. And right now we're in 2020, and prisons are predominantly, I would argue, based on the lived experience of prisoners, spaces of punishment. So it is time to move forward. It is time to consider alternatives to incarceration, which include mental health and addiction support in the community. There's lots of alternatives, and I promise you, they're not even that radical. There were some very promising community-based treatment programs that were launched, for example, in the late 1960s into the 1970s across Canada, particularly in Saskatchewan. There are alternatives that already exist. federally, there's a Section 81 provision for Indigenous healing lodges as opposed to a traditional prison space. So there are other options out there. And one last thing I'd like to bring up is within Ontario, like many provinces, remanded prisoners, prisoners who are awaiting sentencing, who are not yet sentenced, make up approximately half of the prison population. Ontario actually also has the highest rate of criminal charges being tossed out or withdrawn prior to trial. Other provinces vet charges through the Crown Prosecutor, and Ontario actually 2 years ago launched what's called an embedded Crowns pilot project. So if we put more funding into initiatives like this, where charges get vetted through the Crown Prosecutor, we could actually significantly reduce the remand population, which would mean that we don't need to build any more prisons. So I'll close by saying, and I'm sorry I've run over time, I'm not against folks who have come into conflict with the criminal justice system coming to Kemptville. I'm not opposed to this. This is not a not in my backyard situation. This is a not in anybody's backyard situation. What I'm opposed to is building yet another facility that houses folks in conditions that are not conducive to rehabilitation and that do not ultimately ensure community safety. Thanks. I look forward to brainstorming with you about this.